welcome back to The Wellness Effect. In this episode, we further our discussion around diabetes, answering questions regarding how the right diet and lifestyle might affect the disease. Before I get to our guest, I'd like to remind you to hit that subscribe button so you don't miss out on any future topics. Joining me today in exploring this topic is a registered dietitian and accredited diabetes educator, Charlotte Meschede. Welcome, Charlotte.
Thank you so much for having me. It's a pleasure to be here.
Pleasure to have you. So maybe tell us, why are you so passionate about diabetes and educating the nation around diabetes?
Great question. I think that the problem with type 2 diabetes is that it's 100% preventable. So when you have a disease that affects so many millions of people globally, and in Africa, it's also a massive contribution to our disease profile. Absolutely, we can do so much to help prevent that. And the people who do have type 2 diabetes, we can help them manage their condition better by giving them the right tools, by giving them the knowledge, advising them, providing the right medication, and so on. So there's so much that can and should be done to help prevent the spread of this condition.
Speaking about prevention, let's say you have type 2 diabetes, can it be reversed?
It certainly can. It's not very common because it takes such drastic measures.
Yes.
We have recently been exploring, the last 5 or 6 years, in my experience, we've been exploring the use of very low calorie diet programs known as VLCD programs, specifically aimed at reducing the daily calorie intake to 800 calories a day or less. But providing them with the correct nutrition, which they do by using meal replacement formula.
Okay.
You can obviously do it with food, but it becomes more difficult. And, as I was saying, it's a difficult process. When somebody has become an alcoholic, for example, all they have to do is to avoid going to the liquor store or to stop buying alcohol. But you can't stop buying food. And therein lies the problem, because so many people are too busy to buy the right food. They don't know what food to buy. It becomes just such a difficult thing to manage. So dietitians introduced this very low calorie diet program, which has the same effect as bariatric surgery, actually. But it takes time. It doesn't happen overnight. Depending on how much weight has to be lost, how much medication the person is on, will dictate whether there's regression of type 2 diabetes is actually possible.
Incredible. And how does diabetes affect an individual's metabolism and overall health?
It actually makes everything worse. So diabetes is a condition of the blood vessels.
Okay.
So your blood flow is affected in every way. And nothing in diabetes happens quickly. So it takes time for these conditions to develop, and it takes time sometimes for symptoms to even be evidenced. For example, most people who get diagnosed with diabetes have had it for 5 years or more.
Wow.
So it really does. It affects them in so many ways, because at first there's often denial. I don't feel any different.
Yeah.
Or if they've had symptoms and they get a pill to change that, and they take the medication and they feel better, that they don't really realize the damage is going to be progressively getting worse and worse as time goes on, if you don't contain your blood glucose levels to the correct levels, to the correct figures.
Sure. And are there any specific food groups that are beneficial for those who are living with diabetes?
Well, all the food groups are good. Are advised. What I try and do is, first of all, if they say to me right now, where do I start? Because that's what do we stop doing? Okay, because obviously we're sitting here now, we've been diagnosed with type 2 diabetes. Where do we go? What do we do?
Yeah.
And the very first thing I would say is, how much sugar do you have in your diet? Okay, because obviously diabetes is about your sugar levels or your glucose levels in the blood. And if they go too high, it becomes toxic. You don't want them to go too low either, but that's another conversation. Okay, so eating sugar per se, in forms that we do eat it, like cold drinks and sweets and cakes and, white bread. Processed food is probably our main contributor of sugar, and also the different types of bad fat.
Sure.
And it's not just all fat. And most people with diabetes, or most people in the world, actually think that low fat is better than high fat diets and so on. So it's a misconception. And we need to talk about that at some point. But it's really mostly all about the processed foods.
Okay. Yeah. So maybe let's talk about the misconception around sugar and carbohydrate intake. Could you demystify it for us?
Okay, so all carbohydrates will be broken down into glucose, which is the medical term for sugar.
Yes.
So we can interchange them quite happily. What you want is complex carbohydrate foods that take a long time to be broken down.
Okay.
So in other words, those are foods in their natural form, like that have a lot of fiber with them. For example, potatoes, sweet potatoes, whole grains, whole wheat, brown rice, that kind of thing, whole maize. Because yes, those do make sugar, but then again, the quantity is also important, right? So it is all about firstly managing your carbohydrate load, okay, and also what type of carbohydrate that you are eating. When you have a simple carbohydrate like a cane sugar, like your table sugar, or white bread, or white rice, or jam, or a Coke, okay, it reaches the blood levels very quickly because it's already broken down. And that spikes the sugar in the blood, right? With that, you need insulin to take out that sugar in order for it to remain in the levels that is not toxic. Okay. So the insulin then takes the glucose out of the blood, or the sugar, and takes it to a cell in order to make it into energy. To do that, it's got to be recognized by these little receptors on the cell wall called the insulin receptors. Yes. Now, type 2 diabetes is about insulin resistance. And it's a complex process. So not all people who are overweight have insulin resistance.
Interesting.
Okay? Not all people who are obese have metabolic dysfunction. So there's a difference, and it occurs in the whole pathway that creates the insulin resistance to start with. Okay. And with that insulin resistance, you need more and more insulin to do the work that a little should be doing, and your body just builds up this high insulin level over time. And that affects the fat deposition, it affects how you break down food into energy, and so on.
Thanks for that. You mentioned that you don't have to be obese to have diabetes. So how does genetics play a role in this as well?
It plays a very strong role, but it's not the only role. So you can push your genes to be expressed even if you have what I would call a good set of genes.
Yeah.
Okay, so people who have a genetic predisposition to develop diabetes, there's usually one or two genes that are encouraged to be expressed because of the exposure to sugar, lack of exercise, smoking, whatever the other lifestyle intervention may be, or lack thereof.
Sure.
Okay. There are some ethnic groups, some cultures, which are much more likely to develop diabetes should they develop those habits than others, for example. I mean, just to put it into perspective, Finland has got the highest level of type 1 diabetes in the world.
Wow.
Now, who would have thought that?
The happiest nation in the world.
Yes, exactly, whereas certain Hispanics can also have a high level of type 2 diabetes. So can the Tamil Indians, and so on. So you get various groups, ethnic groups throughout the world that are much more likely to develop type 2 diabetes. Okay.
Thanks for that. And maybe what are the common challenges that those living with diabetes face in trying to keep a healthy diet?
Well, for them, what is healthy? Obviously, healthy food can be more expensive.
Correct.
Okay. It's not always accessible. You've got to plan it.
Correct.
Fast food, processed food is just so much easier to come by.
Yes.
And often it's addictive, And therein lies the problem too, because a lot of the compounds that are used in processed foods disrupt the metabolic process that help you control your appetite and
And weight.
satiety and so on. So they really face issues trying to manage daily food intake. And what do? They want something to be fixed straight away. So I want to fix this.
Yeah.
You know, Charlotte, just tell me what to eat and I want to fix it. No, it's not. You know, let's stop a while. Let's go through what you do eat. Let's say you have a McDonald's burger for breakfast. What else is available to you? Could you take a whole wheat roll from home, stick a bit of cooked chicken in it, a bit of lettuce? Could you take that to work rather? Or could you eat that in the car on the way to work? So slowly, you can develop better habits over time. But it's not a quick fix. And for some people who do that, make that sudden change, it's great, but it's not the common trend.
Yeah, I like that you say it's not a quick fix. It's meant to be a lifestyle change.
Exactly.
Complete lifestyle change. Yeah.
And you've got to understand it, and you've got to want the outcome. So what is the outcome that we're looking for? Are you wanting just to lose weight? Are you wanting to manage your blood glucose levels only?
Correct.
Are you wanting to see? Well, my question to many patients is, what do you want to be doing in your second to last decade of life? Okay, so look at that for a bit. So it's not about going to the wedding next year and fitting into that dress or looking good on whatever, on camera. It's about, are you wanting to be independent or dependent? Are you wanting to be able to play with your grandchildren? Do you want to be able to walk with your partner or your children or your dog and not need help? Do you want to be able to see? How important is your eyesight? Do you realize how important that is? So you look at all those parameters and you say to them, let's start somewhere. Let's see, where are you at now? And that's really how I get the process going. You know, get their buy-in long term.
And what do you think about supplementation and alternative diets in managing diabetes?
Supplementation has its place. I don't believe in just taking a whole lot of pills and potions rather than eating a good square meal. Food to me is always your priority. It's always the best option.
Sure.
But there are some situations where, let's be practical. The person doesn't get enough protein, for example.
Correct.
So maybe we use a protein powder as a supplement.
Okay.
Or if they just hate fish. I mean, not everybody likes to eat fish, and we need those omega-3 fatty acids.
Right.
Why? Because they're anti-inflammatory. So yes, I would then suggest taking a supplement. I'm not crazy about just adding a multivitamin, simply because it gives you it gives you a false sense of security there. Rather, eat your food. But maybe we can look at certain nutrients that are clearly not present in the person's diet.
Sure.
Yeah.
And what advice would you give to someone who's been recently diagnosed with diabetes? What are their first action points that they can implement?
Well, one of the things I make them do is write down everything they eat. So they bring me a diet history, and everybody hates doing that because they say it's judgmental. But it's not really. You just have to then acknowledge, what are you eating?
Yes.
And as I say, my main thing is, say, let's try and get rid of the sugar and the processed food. Let's start with that. And then it doesn't seem such a big job after that. It's not so hard to do. And because you've got to give them alternatives.
Yes.
They don't eat processed food doesn't mean don't eat, So, you just say, well, instead of this, you can eat that. And let's look at your budget. What can you afford? I mean, all of those things are very, very important, So that's where I start. I start with taking the sugar and the processed food out. Yeah.
That's an easy first step. Sugar, processed food.
It's simple, but it's not easy.
Yeah.
It really isn't easy,
Yeah.
And some people, it's just a question of, let's not have that Coke. Let's go Coca-Cola or the Fanta or whatever, or the cold drink. Let's just start with that.
Yes.
Because it's all too difficult.
Absolutely.
And you love your coffee, we'll leave the coffee. Okay. We'll leave the sandwich.
Yeah.
But let's just take out the obvious ones, the obvious challenges. Yeah.
And what kind of collaboration is needed between the nutritionists and healthcare providers in helping manage diabetes with their patient?
I'm so pleased you asked that question because it is key to helping that person manage their condition effectively.
Mm,
So I spend a lot of time with my patients. I spend um, probably an hour to an hour and a half for the first consultation, and thereafter there'll be conversations on WhatsApp. Okay, I always relate whatever I've found to the GP or the physician involved, um, and we will have a discussion on
sure.
medication.
Yeah.
So I do also advise on the medication, even though I'm not a doctor, I don't prescribe it. I can see what medication would, or I usually can work out what medication would suit a certain particular lifestyle and so on. So there's a lot of collaboration.
Mm,
And of course, let's not forget the exercise.
yes.
So the
Very key.
biokineticist or the personal trainer or whoever is involved in that aspect, maybe no one, maybe it's just the person itself, that has to come into play.
Mm,
And then as we get through this condition, and the more you look, the more you find. So you will need an ophthalmologist on board, or need a podiatrist on board for the peripheral neuropathy that can occur. Need a cardiologist perhaps, just to make sure that the heart is in good condition. And the blood pressure, obviously, hypertension is quite a big thing. Um, and so on. And a kidney
mm.
specialist. So we look at, as we progress, and we check these parameters all the time. So every year they go through several blood tests and examinations, and then we'll see right now the trend is going towards eye disease. Let's make sure you have your eye
Mm.
screenings done efficiently and annually.
Incredible. I think I've learned a lot, and I think our viewers have learned a lot. So thank you for um, sharing the information, but also giving tangible steps for those who are living with diabetes, but also those who are wanting to prevent that from happening in their life. So thank you so much, Charlotte.
Great pleasure. Thank you.
Thank you to our audience for tuning in. Make sure to subscribe so you don't miss out. I'll see you next time on The Wellness Effect. BankMed, the medical scheme of choice for the financial services industry. The Wellness Effect is proudly brought to you by BankMed, yours in good health.